this confidence that we're on top of this situation. You don't need to worry. Just do as you're told and we'll get over this. No matter how bad it gets, it can only get better because we got your back and we are here. And that person is Dr. Chikwe Ihekazu, the Director General, Nigeria Center for Disease Control. Dr. Sir, can you please be on your feet as we read your citation? Thank you. Billy Rose.
All protocols duly observed. Dr. Chikwe, I will crave your indulgence to come forward, if you don't mind. Yes. Standing on existing protocol, well established, it is customary for us and part of our tradition to bring in very eminent intellectuals and seasoned professionals to speak to us in our public health lecture since we started about 10 years ago. Today, we have with us Dr. Chikwe Ihekazu. We have brought him here because we believe he is most qualified, eminently so, to deliver the lecture, Strategic Medical Laboratory Capacity Building for Pandemic Response, Lessons Learned from COVID-19 Response in Nigeria. The reasons why we'll do this is to emphasize the intellectual credibility and professional capacity and value that this great man has brought to bear in the course of their public life. Standing before us today is the DG NCDC, Dr. Chikwe Ihekazu. Chikwe, whose childhood years were in the small town of Nsukka, was born to Nigerian German parents and obtained his basic and secondary school education in the Federal Government College in Enugu in 1983 to 1989. He holds an MBBS from the University of Nigeria in Nsukka and a diploma in the tropical medicine at the Robert-Karls University, Hamburg, Germany, a master's degree in public health from the Heinrich Heine University in Düsseldorf, Germany, and a fellowship of the European Program for Intervention Epidemiology of the UK Faculty of Public Health. Shortly after his graduation, Chikwe Ihekazu completed his housemanship and Nigerian National Youth Service Corps scheme, during which he provided direct clinical care and public health functions at the Abia State University Teaching Hospital in Aba, Abia State, and the Police College Ikeja, Lagos State, respectively. From October 2001, he worked as a medical epidemiologist in the Robert Koch Institute, Berlin, a German federal government agency and research institute responsible for disease outbreak control and prevention, and was responsible for investigating outbreaks involving hospital-associated infections and the analysis of surveillance data. In 2003, he became a public health analyst at Hungary Primary Care Trust, National Health Service, England. Subsequently, he became a research fellow of the European Program for Intervention Epidemiology Training. In January 2004, where he was competitively selected to join the European Union-funded program, which provided him with service-based specialist training and practical experience in intervention epidemiology. He applied his skills and experience in field epidemiology across a wide range of public health challenges during outbreaks of infectious diseases. Dr. Chikwe Ihekazu was the specialist registrar in public health medicine at the Health Protection Agency Board in England and gained usable knowledge and valuable experience in the control of infectious diseases. I can go on and go on and go on because of our time. Ladies and gentlemen, it is with pride and honor and joy in my heart that I present this noble public servant, Dr. Chikwe Ihekazu, to present the annual lecture, the 15th National Annual Public Health Lecture, to us. Meet a Nigerian epidemiologist, a public health physician, an expert, a man who is indeed a true technocrat, a world-class epidemiologist, and a fantastic administrator. It is my pleasure to bring to the podium, and humbly so to meet you, sir, to present our 15th annual lecture. God bless you.
Thank you.
Your Excellencies, distinguished ladies and gentlemen, we're just going to have a very brief break in transmission. The lecture will be delivered very shortly. The representative of Madam El-Rufai has to take her leave, so she'll be presented the award now, and immediately we'll now take the lecture. We sincerely apologize to Dr. Chikwe. Please pardon us for breaking this flow. President, please, can we get the award? Please, ma'am, the representative of Malam El-Rufai. Professor Leribe will please make, Professor Anthony will make the presentation on behalf of Emeribe. You know, when I asked him to write his name, he asked if I'm a medical lab scientist, and I had to tell him no. So pardon me for that. Can we please give him the award for the presentation? Thank you, ma'am. She is the Honorable Commissioner of Health, Dr. Amina Mohammed Baloni from Kaduna State.
Yeah. The citation. This award is presented by the Association of Medical Laboratory Scientists of Nigeria. A distinguished award to His Excellency, Malam Nasir Ahmed El-Rufai, OFR, Executive Governor of Kaduna State, as a hero for COVID-19 response in Kaduna State, presented this 20th day of May 2021, Madam. Congratulations. Good.
I would like to make before I say anything, I would just like to say I am not the Commissioner for Health. I'm the Special Advisor Intergovernmental Relationship to the Governor of Kaduna State. I'm deeply honored and humbled to accept this COVID-19 Icon Award by the Nigerian Medical Association of Medical Lab Scientists on behalf of His Excellency Malam Nasir El-Rufai. I would like to also accept this award on behalf of all the health workers, caregivers, and most of all, the lab scientists of Kaduna State. Thank you very much.
Thank you. Thank you very much for accepting the award on behalf of Malam El-Rufai, and we wish Kaduna State well. At this juncture, I'll hand over the microphone to Dr. Chikwe for the keynote lecture. Please, can we settle down? Let's leave all the sharing, no water being passed. Let's settle down because this is like the real high point of this occasion. Doctor.
Thank you. And thank you, sir, for the very generous introduction. Firstly, let me acknowledge the presence of His Excellency, the Deputy Governor of Jigawa State. Thank you for honoring us with your presence, sir. My brother, the Register of the Medical Laboratory Science Council of Nigeria, and of course, the President of the Association of Medical Laboratory scientists of Nigeria, all the elders in the house. If I start mentioning one by one, I'll get into trouble, but I think the protocols have been very well established, so I'll stand on the rest. Ladies and gentlemen, dear colleagues, it is really an honor to stand before you today to offer you a few thoughts on what we've been doing collectively with many of your colleagues, many in this room, many walking across the road at our agency in transforming medical laboratory science in Nigeria. Next slide. So, next slide. So for many years, I used to do a presentation whenever I spoke. And this was the slide I often started with. It's a slide from the Time magazine warning people of the coming of the next pandemic. Of course, many people thought that this was wishful thinking, science fiction. It would never happen. And now we're in the middle of a situation, next slide, that we're faced with a pandemic that has killed over 3.3 million people. That is half of the population of Liberia. So think about it. A pandemic that did not exist, an infection, a virus that did not exist more than 1.5 years ago. And we have lost collectively in the world over 3 million people. Next slide. So the next few slides are just demonstrating the impact of this pandemic in the world, in Africa, and in Nigeria. In Nigeria, we now have just over 165,000 confirmed cases and just over 2,000 deaths. We have definitely been spared the worst of this pandemic so far, even though for every family that has lost a loved one, each one of those 2,000 means a lot, as you can imagine. So let's not trivialize the fact. Just go on. Next. Next. So this is where we are. This is our website as at last night, showing the number of cases in Nigeria, 165,000. We've done just over 2 million tests, and we've lost just over 2,000 people. Next slide. Now, this is the epidemic curve as we have analyzed it as at yesterday. You will see that you will recognize this. Our daily numbers have been less than 100 cases per day for the past several weeks now. And as much as we're happy with where we are, it also leaves me with a lot of trepidation because of the inevitable complacency that happens when case numbers are so low in the context of a virus that is still spreading and causing a lot of harm in many countries in the world. So our collective challenge, mine and yours, is how to sustain the efforts that we've made to continue protecting the health of Nigerians. And that's a little bit the area that we'll be reflecting on today. Next. So a few months ago, when the DG of the World Health Organization, as part of his weekly teleconferences, used the phrase, test, 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 as the only way out of the pandemic, it put us under incredible pressure because we knew at the time we were not in a position to test, test, test. We were not. We had a new disease. We just weren't prepared. Yes, we could make a few diagnoses in a few labs, but we were not in a position to do what the DG wanted us to do, which is to rapidly escalate testing capacity in Nigeria. But we didn't go to sleep. We took this as a challenge. Next. We took this as a challenge and came up with a national strategy that can be summarized into these 4 terms: to test cases, to track cases, identify contacts, isolate cases and treat cases, and minimize the spread in communities. And of course, there are long documents of strategies that accompany this, but this is a simplification of what we made out to do as part of a public health response. Next. Next. So I'll talk a little bit about what the laboratory response has been. On the 7th of January, we notified and disseminated to the country the fact that a new virus had been flagged somewhere in the world. And even before we had any case in Nigeria, we issued a public health advisory advising Nigerians, listen, there's a new virus somewhere in the world, in China. These are the risks that we face. This is what we know about it. These are the mitigatory actions that you could institute. We then started quickly looking for how to build the capacity to test, at least if we find a suspect case, to be able to identify it in Nigeria. So by the 24th of January, we had set up that capacity in a few labs in Nigeria, and we had a lot of false alarms. Everybody knows about the first case that came into Lagos and then went to Ogun State, but nobody knows how many suspect cases we had tested beforehand and discarded as negative. Because remember, at the time, we were focusing primarily on people coming from China. And our first case ended up coming from Europe. We set up a COVID preparatory group, and we started training people on case management very early. So this is just to show you that even before the first case, activities had started. And that is why it's important to have a national public health agency that can work for Nigerians, even when they're sleeping at night, identifying threats, analyzing those threats, and working to mitigate next the impact of those threats. And then on the 27th of February, next slide, the first case was identified in Nigeria, and our national response started. So when we talk about laboratory diagnosis for this virus, remember, there are many objectives depending on the setting that you work in. Of course, there's an objective of diagnosis, to identify patients and to treat them. But that's not the only objective. Sometimes we test for public health screening purposes. Right now, we're testing, the new stream of NYSC has just started, and every camp in Nigeria, before a new copper gets into that camp, he's tested for COVID-19. Not because for the virus that causes COVID. Not because we think he has it, but because we want to create a safe environment for young people to carry out their youth service. We also sometimes test just for public health surveillance purposes, so we understand the burden of a disease in a country. We recently carried out a large HIV survey in Nigeria. It wasn't because people were particularly ill from HIV, but we wanted to understand the burden of disease. So it's important always to understand what the objectives are for diagnosis when tests are done. Next slide. So this is where we were in February when we had the first case. We had 3 labs. There's actually a 4th one that is not on this slide, the Africa Center for Excellence in Genomics in Ede, who also had the capacity, but they developed that capacity on their own. So the labs that we had activated, supported for COVID testing in the very beginning is the National Reference Lab in Abuja, the Lagos University Teaching Hospital in Lagos, and the Irua Specialist Teaching Hospital. So those are where we focused in the very beginning to assure ourselves that at least we have capacity to make this diagnosis should this virus enter Nigeria. Next slide. But in addition, very quickly we drew up a strategy to scale up testing because these things don't happen on their own. So we put together a small group and came up with a strategic approach to scaling up testing that included, 1, the expansion of the NCDC laboratory network. I'll speak more about that. We agreed to leverage existing capacity in high throughput labs that existed in the HIV PEPFAR network through the TB diagnostic network across the country. So firstly, the HIV network, and thirdly, to deploy gene expert machines that were already positioned across the country and convert them to support the COVID testing. We also came up with a strategic approach to enroll the private sector, bring in private labs into this testing process, and ultimately to introduce the use of antigen-based tests. So this was our strategic approach. To do that, we had to identify where the open PCR systems existed at the moment. So wherever there was a rudimentary system, whether it was in a lab, in a hospital, or in a university, we went to that place, understood the basics of what they had, understood the gaps, and quickly tried to improve on those gaps, ensure that they can start testing, knowing that they wouldn't be in an ideal lab in a few weeks. But at least it was better than starting from zero. We identified where the HIV program, and you can now see some of the deficiencies in our health system, because the HIV labs are managed by the HIV program, the TB labs are managed by the TB program, and to access any of these labs, we had to negotiate not only with the facilities in which they were, but also with the programs that were managing those diseases. So these are some of the lessons that we're now learning from this outbreak, that we have to integrate our laboratory services so that we don't have to negotiate with different disease programs when we have the next pandemic. But that is what we faced last year, and we had to deal with the country we had, not the country we wished we had. So we started looking at where this infrastructure existed and started discussing with them. And of course, all of them were open to this collaboration because it was in everybody's best interest to come to the end of this pandemic. Next. But in